I want to swing to a different direction a little bit and talk about ethics and governance. What are the biggest concerns that you hear from clinicians, administrators, and legal teams maybe when it comes to deploying AI in breast cancer care?
I think a lot of the big concerns come from the use of language models. One concern comes that uh, when you access a commercially available language model platform such as ChatGPT, and you provide information into that platform, it goes into the cloud, and it even if there's options to say have a temporary conversation where it's they say they'll delete conversation data, some limited amount is retained. It's not truly HIPAA compliant and protected, and so you have to be very careful about what kind of data that you're putting into the models and make sure that you're compliant with you're not sharing any PHI with the models. I think that's definitely a big concern of hospitals and hospital administrators. So much so that our hospital, and as well as I know several others, have internal versions of some of these language models that are hosted on their own servers from a prior model checkpoints, so that they can control the flow of data to ensure that we're not uh, inadvertently sharing patient data inappropriately, because we might look you could imagine you could look up get some information about studies relevant to a patient's treatment, and if you accidentally provide a little bit too much information, that's going to be a big problem. um, Another challenge is with regards the language models are inherently there is a randomness inherent to how output is produced for language models. And so that essentially guarantees that you're going to get some inconsistencies, even if you provide the exact same prompt multiple times. And uh, this, again, they could be helpful tools, but in the same way as for many of the computer aided diagnosis for a radiologist, they might suggest lesions that are suspicious. The radiologist ultimately has to review those and make a decision based on their own expertise. Make sure that it's not related to some artifact or something else that is inappropriate. And similarly, I think any kind of recommendation from some of these language models that are in use has to be vetted with a clinician's own expertise. And there's not going to be a legal argument to say, well, ChatGPT told me this was the best strategy. That's going to, you can't do that. You'd be in trouble. Um, Another kind of related, I think, ethical issue is there was an interesting study that showed that um, one non-oncology use of AI, or is like kind of more peripherally related, is the use of AI for endoscopy for colon polyp detection. And there was a study that found that after use of some of the AI models to improve colon polyp detection, that gastroenterologists, if they stopped using that AI support, that kind of was helping them, that actually their detection rates would decrease to below what they would have been before using that technology. And so I think that's kind of another concern. And I mean, that's a concern, I think, across education, the whole educational spectrum. Our is over reliance on AI going to degrade our critical thinking as well as our own knowledge base? Um, that's kind of a theoretical concern. I think that I think we have to, in the end, accept that AI is here. It's going to impact how everything is done, including in medicine. And uh, rather than um, avoiding its use or putting our heads in the sand, we have to understand what are the biggest areas these models can make a difference, how to use them responsibly and appropriately. And I think ultimately that'll lead to better outcomes for everybody.